Good afternoon and welcome to today's webinar, Climate and Environmental Health. I'm Matt Reese, GreenGov Deputy Director. Today's webinar is co-hosted and supported through our partnership with Penn State Sustainability. The GreenGov Council was established as the Commonwealth Agency's Lead by Example program, promoting energy conservation and sustainable governance. Our charter sets forth performance goals for the Commonwealth, ultimately steering the reduction of greenhouse gas emissions within our portfolio. Additionally, agency goals focus on fleet electrification, high performance buildings, annual energy reduction, and the use of renewable electricity. Visit the GreenGov website to learn how agencies are meeting these performance goals. You'll find a host of information, including past years of agency certification checklists, informative webinar recordings, portfolio tools that may assist in developing and achieving your own performance goals. Now we are pleased to introduce our friend, colleague, and partner at the Penn State Sustainability Institute, Peter Boger, PhD. Peter is the Assistant Director for Community Engagement at the Penn State University Sustainability Institute and responsible for developing strategic programming and partnerships such as this one with the GreenGov Council that help Penn State leverage its resources to promote sustainability throughout the Commonwealth of Pennsylvania. Go ahead, Peter.
Thank you so much, Matt, and thank you everybody for joining us for this, our first GreenGov webinar of 2024. This has been a real privilege and pleasure for us to be working with Matt and Mark and the GreenGov Council this is our 5th series now. Like the GreenGov Council, Penn State Sustainability, which we recently rebranded to, is responsible for looking at a large institution, in our case, the entire Penn State system, all 24 campuses, and saying, how can a very small band of people help everybody else be empowered on their sustainability journey, and think about how you implement sustainability and put it into everything that Penn State does, whether that's teaching, research, community engagement, or operations. And similarly, the GreenGov Council is there to help empower the entire Commonwealth's state government. And I think what's interesting for both of us is you heard Matt talk about how the GreenGov as its mission is focused on reduction of greenhouse gas emissions. And yet we're talking today about health issues. And that speaks to the fact that all of these issues of sustainability are ultimately about intersections. And they're about intersectionality of different issues that you must address concurrently. And so we are excited to put on this series with the GreenGov Council and think about how do the issues, primarily we start with the climate change, but how do they trickle down and impact issues of health, social justice, well-being. And as you've seen, if you've attended any of our other webinars, they touch on food systems, housing systems. And so we're excited with today's webinar to hear from our 2 distinguished speakers, and we hope you will join us for many more. So I'll hand it back to Matt.
Yeah, thanks so much, Peter, and we really appreciate the partnership. And it's hard to believe that this is we're basically nearing the middle of the 5th webinar series, and it's and all of those past recordings are available again on the GreenGov website for your review and reference, as this one will be after we complete it too. And next is our first presenter for today's webinar, Nate Wardle. Nate is the Special Response and Projects Manager within the Pennsylvania Department of Health's Bureau of Emergency Preparedness and Response. In this role, Nate is involved in addressing incidents, disasters, and emergencies. Nate is on the front end of the department's response to threats facing the public health sector and healthcare, including climate change, disease outbreaks, and cyber threats. Nate has previously held multiple roles within the Department of Health, including Public Information Officer and Press Secretary, leading public communications and messaging. Nate lives in Mechanicsburg with his family, enjoys sports, staying active, and is an avid runner. Go ahead, Nate.
Thank you very much, Matt. Really appreciate it, and appreciate the opportunity to be here today, speaking to each of you about some of the things that we are doing within the Pennsylvania Department of Health. I'm excited to also be followed by Stephanie Hassanale, and I know Matt will introduce her whenever I am done, but Stephanie's been doing a lot of the actual work on this. I'm just helping to steer the ship along, so we'll talk about some of the things that we're doing, both from a planning perspective and then as we actually move things forward within the Department of Health and all of the partners that we work with. So we're going to largely, at least for my section of the talk today, talk about our State Health Improvement Plan. The State Health Improvement Plan is a plan that was developed for the years 2023 through 2028. And our goal within environmental health is to incorporate environmental health strategies and activities into the State Health Improvement Plan and other public health planning efforts. So why environmental health? Environmental health, a changing climate, and the importance of environmental justice for populations that have for decades been disproportionately affected by environmental concerns is a priority for the Pennsylvania Department of Health. I think it's really important for us to acknowledge that we're not just looking at environmental health and a changing climate and environmental justice separately. They all go hand in hand. In addition to our work on health equity and how we are making sure that we are working to ensure health for all Pennsylvanians, which is part of our vision and mission for Pennsylvania and for the Pennsylvania Department of Health. So now I'll give a little bit of an introduction into the State Health Improvement Plan, what it is, and how we get to where we are in it. So it is a multi-year strategic plan, and as I said, it started in 2023, running through 2028. It is data-driven. It is a comprehensive process for identifying health priorities in Pennsylvania, and it is a resource for establishing and maintaining public health programs, policies, and partnerships. So here's the structure of the State Health Improvement Plan, and I will admit that I had to blow it up a little bit so that it was big enough for you to see, so that's why it's a bit distorted. But the overarching goal is to improve the health status and life expectancy of Pennsylvanians and to eliminate health inequalities. And then there's three main work groups for that. The first is health equity, the second is whole person care, and the third is chronic diseases prevention. I'm going to focus mostly on the health equity area, where our focus is to improve health equity by addressing the social determinants of health. And for those who aren't familiar with that term, social determinants of health, think of all of the things that impact health, such as housing, or your job, or your income level, your reading level, your ability to attend school. All of those different things are just some of the factors that go into the social determinants of health. So what are the goals under the health equity section? There are three goals. The first is goal 1.1 to increase financial well-being, food security, and safe, affordable housing. The second is to increase community safety by reducing the number of violent incidences that occur due to racism, discrimination, or domestic disputes. And the third, and what we'll focus on today, is improve environmental health, focusing on environmental justice communities. And so within environmental health goal 1.3, we have three main objectives that we are working on. The first is to improve air quality. The second is to reduce heat-related illness. And the third is to increase childhood lead testing. So objective 1, to improve air quality. Our goal is to increase the population living in counties meeting the National Ambient Air Quality Standard, or NAAQS, for a particulate matter of less than 2.5 microns in diameter, PM 2.5. And our goal is to increase the population that's meeting the standard by going from 61.2% in 2019 to 66% in 2028. And obviously, air quality has been a big topic issue in 2023 that we just came out of due to all of the effects on air quality that we saw from the Canadian wildfires. And so it is certainly top of mind. Second objective is to reduce heat-related illnesses. And our goal is to reduce the number of heat-related hospitalizations from 206 in 2020 to 185 in 2028. And the third objective is to increase childhood lead testing. Our goal is to increase the number of 0 to 71-month-olds tested for lead from 148,432 in 2020 to 163,275 in 2028. So what were some of our strategies for the first year? I talked about it being a plan that went from 2023 through 2028. And so our first year, 2023, a lot of it was to grow our Goal 1.3 team. Stephanie and I actually had to lobby a little bit to have this goal included within the State Health Improvement Plan. There's a voting process, and while everybody saw the importance of environmental health, it didn't end up among one of the top scoring areas that was going to be included in the State Health Improvement Plan. But we lobbied, and those who are kind of the authors of the plan obviously saw the importance of environmental health as well. And so we were able to have a goal added around environmental health, but we were a bit behind the 8 ball in terms of getting started at the beginning of the year. And so one of our big goals for 2023 was just to grow our team. And that's something that we were very successful at. Our goal was to add at least 10 people in 2023 from at least 6 different agencies, and we were able to do that. And one thing I will highlight is most people hear about this and they assume that a lot of the individuals who are working on it is from the State Department of Health or the local and the local county municipal health departments. And while that is true, our goal is always to include additional individuals from various organizations. We have individuals from DCNR. I believe we have at least one person from DEP, or at least we're collaborating with DEP as part of the State Health Improvement Plan. We have individuals from the GASP, the Groups Against Smog and Pollution in the Pittsburgh area. We have individuals from healthcare systems and just from a number of different groups. One of our other strategies was around public meetings and education. And our goal was to really begin to talk about publicly environmental health and what the department is doing in terms of a changing climate and environmental justice. And while meetings like this are a great way to do that, our goal is to be in the communities, especially those communities that are environmental justice communities, talking about how we can assist them. And we didn't really get that off the ground in year one, but it's something we've carried over for year two. In terms of increasing population with active PM 2.5 monitoring, we've had some conversations with the Department of Environmental Protection about how we can better do that. We know that obviously last year was a year that everybody thought a lot about PM 2.5 and air quality and all of those types of things. So how can we capitalize on that, increase the amount of the population that we are making sure that they have clean, healthy air to live? Increase our extreme heat awareness. We actually did a lot of things in regards to this. I know Stephanie's going to talk about some of them in her presentation, so I won't steal her thunder here, other than to say that the Division of Environmental Health Epidemiology, which is where Stephanie works, the team that works there has done tremendous work in this area in 2023, and I know that will continue in 2024 and future years as well. To plant more trees. We had a goal of planting a certain number of trees and a certain number of them within environmental justice communities. And then we had a conversation with DCNR and found out that this is something that they're doing on a regular basis, and the trees are being planted primarily in environmental justice communities. Some of this is through some of the recent funding that has come from the federal government, including the Inflation Reduction Act. But some of it's just kind of their goals as well. And so some of these strategies that we had, we found out through collaboration and conversation with partners that the work's already occurring. We just needed to be aware of it. And a lot of that comes down to continuing to build our partnerships. And that's something that we've been able to do through growing our team and having conversations like this to learn what is occurring both within state government and also outside of state government. And then our last strategy was around lead prevention. And so we wanted to work to educate individuals both within the Department of Health and that we work with on a regular basis about the dangers of lead, about how to work with individuals who may be exposed to lead, and just what people should watch out for. And then so there was a lead education component, and then there's also the lead prevention component. And a lot of that work is being carried out by our local health departments. We talked to Erie County and Allegheny County, Chester County, Bucks County, Montgomery County, Allentown Health Bureau, Bethlehem Health Bureau about some of the work that they're doing, and the local health departments are doing really meaningful work in this area. I think it's work that we would love to do from a state perspective as well. The funding's not currently there to do it at this point, but a lot of the things that they are doing in the local health departments could certainly be seen as best practices as we move forward. So now that I talked about those, some of our proposed year two key strategies, some of them, as I said, we're going to pull over in terms of some of those public meetings and things related to that. But some other ones include educating healthcare professionals about the risk of a changing climate and how that affects what they do on a regular basis. We've had some great conversations with the University of Pittsburgh and UPMC about the work they're doing to become a carbon neutral healthcare system by 2050. And actually, they just presented to our internal climate change and public health work group on Monday of this week, and they're just doing some fantastic work. And so we hope to work with them to help educate other healthcare professionals across the state about the threat of a changing climate and environmental health. We hope to meet with some businesses and have discussions with them about how the practices that they are doing could be affecting environmental health, or how the practices that they're doing are working to improve environmental health. And so hoping to have those conversations about how we can better partner for a better Pennsylvania as we move forward. We want to educate on the importance of trees. I talked about trees being planted, and that's fantastic, but our goal is to really work more on the local level to talk to local leaders, whether it is shade tree commissions, whether it's local planning boards, or local municipal government, talk to them about how trees are important, whether that's in some of their ordinances about if somebody's planning or building a house or whatever they may be doing to uh, change their property, why it's important that they don't cut down their trees, or if they do, that they plant new ones. So certainly educating on the importance of trees. We want to increase our lead testing rates. Like I said, we've done some communication around that in 2023. So our goal in 2024 is to put that into action and see those lead testing rates increase for individuals who are 0 to 71-month-olds, and then work on home-based educational programs. So some of these programs are related to asthma, again, lead, vector-borne disease, and a number of other things. Just how can we have more opportunities to discuss in the home what people are facing in their homes and how we can best assist them from a state health department perspective. And so my next to last slide is how can you help? And the first thing I would say is if anybody is interested in joining our team, I would say please reach out to us and let us know. Stephanie and I are actually the leads for this goal, so you get to hear from both of us today. But we'd be very happy to have anyone join our team, provide your input. We ask that you help us implement our work or ideas in environmental justice areas. Most of us are located in the Harrisburg area, and so we obviously have some environmental justice areas in the communities in South Central Pennsylvania, but we also know that we need opportunities to be in Chester and Philadelphia and parts of Pittsburgh, and talking to these communities that are environmental justice areas to get their ideas of what they need to see. It's not just a matter of what our plan is and kind of speaking it down, but we want the ideas from those people who are most affected, and see their environmental health affected on a regular basis. And so any work that anybody can assist in that area is extremely valuable. And then to go with that, suggesting new strategies. I mean, we have our strategies that we're working on for 2024. We're going to be finalizing them here in the next couple weeks. But our goal is really to make sure the strategies are ones that are assisting and impacting Pennsylvanians in a positive way. And so we want to make sure that those strategies we're choosing are the ones that are most important, are going to be most beneficial. So that is what I have. If anyone has any questions, comments, wish to join our team, or anything else, my email is here. And certainly if Matt wants to share the slides afterwards, or if they're going to be in the recording, you'll be able to see my email there, and you can reach out to me. I'd be more than happy to share more about what we're doing, give you a little more of an introduction if you would like, if you're interested in potentially joining our team, or just talk further. Thank you.
Thanks so much, Nate. It was really fantastic to hear what the department is doing, and it's really, really, really terrific actions. And of course, we will share the slide deck in a follow-up message from this webinar, in which we will share a link to the webinar recording as well. So, and we'll save the questions till the end. But and next up, we're going to move on to our second presenter for today, and it's Stephanie Hassanali, PhD. And Stephanie is the program director for the Environmental Public Health Tracking Program within the Pennsylvania Department of Health's Division of Environmental Health Epidemiology. Stephanie has been with the Department of Health since 2017 and has worked to build capacity and address health disparities within several areas of environmental and occupational health. Stephanie has received her PhD in sociology and demography from the Penn State University in 2015. Thanks so much for your time today, Stephanie. We're looking forward to it. Go ahead.
All right. Thank you so much. Can you hear me okay?
Yes.
All right, great. Thank you again for the invitation to present. Nate and I have been working really hard on the things that you have seen and will see from me. I am Stephanie Hasanali from the Division of Environmental Health Epidemiology, and I'm, like you said, I'm the program director for our environmental public health tracking program. And that is all a lot of jargon. So basically, we aim to help the public understand what is happening in their community and in Pennsylvania and advocate for cleaner and safer environments. So I will be giving a brief introduction of kind of where we sit within the Department of Health, and then highlight some of the projects that we've been working on, some that closely align with the State Health Improvement Plan that Nate just shared, and some that align with our Environmental Justice Strategic Plan. So we have six, let me go to the next slide. We have six divisions within the Bureau of Epidemiology. And like most of public health, our Bureau grew tremendously during COVID. In environmental health, most of our funding comes from CDC grants, so we continue to apply and receive grants from CDC. So these are shown on the next slide. So this is roughly how our division is organized. There's 6 big boxes for our grant programs, and they either have support from CDC or from the state. The climate and health initiatives and the environmental justice initiatives are new, and I have them in that top right box. But really, they could start to be coming down to be a large blue box in this case. There's going to be a new CDC grant for climate and health, hopefully put out sometime later this year. And we have been able to hire one CDC funded staff member, Robert Gottlieb, who's on this call, who's an epidemiology research associate, and who's really beginning to grow the climate and health program. So we are making a lot of headway there. So going back to Peter's introduction, a lot of our approach to environmental health takes on an intersectional nature. And so I just wanted to list a few of the things that, a few of the principles or ideas that we feel towards environmental health. So we really see this climate resiliency, health equity, and environmental justice as a triad, and they're inseparable. So you can't make progress on one without attempting to make progress on another. And then there's the way that environmental health has traditionally been defined leaves a lot of the climate and health impacts kind of outside of it, but we kind of see it as an all hands on deck approach. So even if people say they work in family health or infectious disease or highway safety or refugee resettlement, all of these people will need to start to think about how their work is impacted by climate change and how they can support the adaptation and resilience of Pennsylvanians. So this is an animation from CDC that I wanted to bring up to kind of highlight the intersectional nature and how many different factors fall under environmental health and climate change and human health impacts. A few of us recently listened to a training from someone at the Department of Homeland Security, and he talked about how by 2070, a fifth of the world's population will need to move because of climate change, and we're up to 8 billion people. So the scale of this is really tremendous. And this animation is available from CDC Climate Effects and Health webpage. So I'll highlight 3 environmental health initiatives that we're currently working on. And these are really team efforts within our division and with Nate's help. So I just want to, really thank the team for all of their work in this regard. The first project is the Environmental Health Indicators Map, and you can scan that QR code to be taken to the map. This map was launched in May of 2022 to show environmental, social demographic, and public health data. Right now, the map has 61 layers, and we are currently working on a second version of the map that will be out later this spring. And it will include additional layers on reproductive health outcomes, cardiovascular disease deaths, private well density, and many climate and health indicators. And I'm happy to talk more about the map after. Oh, and I did want to actually answer the question in the chat about EJ. We do include an environmental justice layer now that's based on DEP's previous environmental justice definition of the percent in poverty and the percent people of color. But we are moving with our new version. We are going to be moving to DEP's new Penn EnviroScreen definition. So that is more similar to Cal EnviroScreen. And I'm happy to talk on that more afterwards. The next project is the Heat Stress Project, and this is a partnership between our Environmental Public Health Tracking Program and our PNOSHS program. That's Pennsylvania Occupational Safety and Health Surveillance Program. And we're really focusing on creating outreach materials for high-risk populations. So far we have created materials for workers, and we asked a number of different partners about potential languages to have those translated into. And so we were able to translate them, I believe, into about 8 languages. We translated them into many common refugee languages, such as Arabic, Nepali, Dari, Pashto. And we shared them with our refugee health program, and they actually distributed it nationally. So that was a really exciting partnership for us. Our plan moving forward is to create materials for additional at-risk groups. So right now we're working on materials for children and schools and associated teachers as well. And then finally, we're working on building capacity to monitor heat-related illness data, specifically in our syndromic surveillance system or emergency department data. And then also associating that with weather alerts and temperature and atmospheric data. So more to come on that. If we present again, maybe we could do that one. And then finally, we created an internal response plan for extreme weather-related events, and that was finalized in the fall of 2023. And we came out with this plan mainly in response to the wildfire smoke events that happened last year. Many different groups contacted DOH about how to respond to the wildfires, whether they should cancel events or whether they should stop their HVAC intakes. So there was a lot of planning that needed to happen after that event, and we wrapped that all into an extreme weather events response plan. And we're currently kind of making our implementation plan for that plan. There's many plans in public health. And we've delineated things to do to get ready for the event. So things we need to have, like fact sheets, how we want to respond when an event occurs, like how do we want to put out information to different groups like healthcare providers, and then what are some activities we can do to improve our response efficiency when it's needed. Okay, so we other environmental health activities include making many basic plain language educational materials. We have spoken with a lot of community members. One of them was a physician in York, and she was talking about the large Haitian Creole population and how they have low literacy, not only health literacy, but low literacy. And so creating very plain language, clear instructions for recommendations is really important. And so this is just one example. We created a mold and health fact sheet earlier this year. And then, like I said, we think it's a priority to translate these kinds of documents into different languages, especially because healthcare providers have asked us for them, and there's not a lot of materials out there across the country in some of the more unique languages, or languages that don't have quite as many people speaking them in the state. We are also developing internal and public-facing dashboards to promote the use of environmental health data in decision-making. And that has to do, like I said, with one of them will be an air quality-related or heat-related illness dashboard for the emergency department data. And then really just widely speaking, we would like to promote environmental health capacity wherever necessary. Nate mentioned that, we had to lobby to get the environmental health goal into the SHIP. And so there's things like that come up, and we want to make sure that people are thinking about environmental health, environmental justice, climate change, et cetera. Some of the newer initiatives are supporting partnerships with universities by having these affiliation agreements that then we can have additional interns or fieldwork students come in and help us with particular projects. And then another big one for me is supporting greater funding equity. And so there's partners that don't realize that they can become a state vendor and help us with certain projects. And so getting the partners that work closely with environmental justice as state partners is, to me, a good way of kind of reaching back to the community and making sure that the right people are at the table and can apply for state funding. And here's the contact information for our division. I'll also put my email address into the chat, and happy to talk about environmental health anytime. Thank you so much.
Thanks so much, Stephanie, and also Nate. Fantastic presentations today. It's really exciting and terrific to see the actions and the programs being lifted up in Department of Health, and we really appreciate your efforts. And we're going to go ahead and stop the recording now.